I don't like to sit. Okay, we're going to demonstrate a venipuncture. We're going to start with a patient. We're going to identify the patient first to make sure that we have the correct patient. That's the most important thing that we do. Once we know we have the right patient and that they have prepared themselves either by fasting or not fasting for the lab studies ordered, we're going to get our supplies out. This patient is going to have some chemistry tests done using serum, so we're going to use a red tube with no additive. And then he also has to have a CBC, which is complete blood count. This has an additive in it for EDTA. All right, we're going to choose a needle tube holder with a safety device and a 22 gauge needle. I'm going to prepare that right now by opening this needle up. Okay, and we're going to just insert that right there. And we're going to have this ready. I have my tubes ready. I'm also going to have gauze, and I'm going to have some tape for at the end to put over to the puncture site. Okay, I'm going to tie the tourniquet because I want to make sure that my patient's veins are acceptable in the area that I'm going to be doing the venipuncture. So I'm going to tie the tourniquet, and I'm going to also have gloves here to use. And I'm going to feel for my vein. Okay, you never can really see a vein sometimes. It's better to feel for a vein. Okay, and once I know where that site is going to be, I'm going to clean the site. Work from the inside out. Now we won't keep the tourniquet on for more than 1 minute. Okay, so if I knew I had to have that on more than 1 minute, then I would have to release the tourniquet and then reapply the tourniquet. Okay, I'm going to allow that alcohol to dry so it doesn't interfere or compromise the results of the test. Also, we don't want that to sting the patient off. I'm going to apply gloves now because right now I will be working with blood. So since we have body fluid, I want to make sure I'm protected with my proper PPE equipment. Okay, I'm going to get the first tube. The first tube that I draw will be the tube with no additive in it, which is the red top tube. Right, and when I take the cap off the needle, I want to make sure that the bevel side is up, and I'm going to just put the tube right into the tube holder. I'm going to hold my skin taut, all right, and I'm going to insert the needle into the vein. Okay, once the needle's in the vein, I'm going to pull back on the flange and push with my thumb. Okay, and I'm going to watch as the blood flows into the tube. And once the blood has reached its capacity, all right, it will stop. And I'm going to change tubes. I have to be very careful that I don't move the needle in the patient's arm. I'm going to just twist it and pull it out. And I always work to the left. I never cross over the arm with the needle in. And once again, I'm going to push and hold back with the flange. Okay. Now, this is the last tube that I'm drawing. So I'm going to release the tourniquet to stop that blood flow. Okay, I also am going to release the tube from the needle in the tube holder. Okay, I'm going to get my gauze ready. So as I pull that needle out, I'm going to put the gauze and pressure on the site. And I'm going to use the safety device. I would put this in the sharps container. All right. With the EDT tube, it has an additive, so I have to invert this 8 times. Okay, because I'm mixing the additive with the blood. I'm going to check now, make sure that the patient is no longer bleeding from the site. I'm going to put the gauze across the site of puncture, and now I'm going to put some tape across there. I'm going to check with my patient. How do you feel? Okay, you feel okay? You're not dizzy or anything? Okay, then you are ready to go. Thank you very much.